It is that time of year where it is getting darker, earlier, back to school. It's also September, which is Gynecologic Cancer Awareness Month. And this month I'm going to be talking to you about all the 5 different gynecologic cancers, which are ovarian cancer. And in ovarian cancer, we also think about fallopian tube and primary peritoneal cancer, because those are treated essentially the same. We also think about uterine cancer or endometrial cancer, cervical cancer, vulvar cancer, and vaginal cancer. We're going to talk about all of them this month. So what I want you to do in the comments before we get to this video, which is going to be on signs and symptoms of ovarian cancer, is in the comments, I want you to tell me what questions you have about the different gynecologic cancers and what topics you want me to cover this month. I'm going to do some substacks on it as well. Now, as we think about the signs and symptoms of ovarian cancer, this is where it gets challenging, because ovarian cancer does not have any signs or symptoms typically until it is more advanced, such as at stage 3 and stage 4. And we don't have a great screening tool for ovarian cancer like we do with cervical cancer with the pap smear or mammograms for breast cancer. And I'm going to talk later this month about screening and why we don't have great screening. But because we don't have great screening and because symptoms don't present until it's more advanced, that's why ovarian cancer is often diagnosed at a later stage. And the signs and symptoms are often very vague. Bloating or fullness, early satiety, meaning you feel full after eating a smaller amount than you normally would. Weight gain, especially in the abdominal area, part of that bloating. But often someone does not present with those signs and symptoms, and they can be really vague. They can simply be a vague abdominal discomfort. They can be changes in your bowel habits. They can be reflux symptoms. And because the symptoms are so vague, sometimes they are attributed to other presentations or other diagnoses, such as irritable bowel syndrome or heartburn, even menopausal symptoms, medication symptoms, I mean, you name it. And so we don't necessarily need to jump to ovarian cancer anytime someone comes in with a little bit of bloating, but we should be thinking about it. We should be doing the appropriate workup, especially if symptoms persist, don't go away, get worsen, and treatment for what we think it is doesn't improve the symptoms. So my point in saying this is that because the symptoms of ovarian cancer are vague, it is often attributed to other diagnoses, and we want to make sure that we do think about ovarian cancer. And here's where knowing if you're at higher risk for ovarian cancer becomes really important. We're going to talk about risk in a separate video. I hope this is helpful. If you have been diagnosed with a gynecologic cancer, know someone who has, share in the comments. Let me know what topics, questions you want me to address this month.